10:29 right here on this 26th day of May. Our friends from OSF Healthcare and SSM are in studio today. May is Stroke Awareness Month, and something that does mean a lot to me because of our family experience with this is talking about ways that maybe we can spot these symptoms early and take care of the situation before it gets rapidly advanced. And guys, thank you so much for joining us today and really being a part of this. We're joined now by Heather Main and Dr. Alshekhlee for joining us in studio. Guys, how's your morning? How was the commute on 270?
So smooth.
Was it?
So smooth.
There you go.
Not too bad.
That was when I left St. Louis Radio, it was like I just did a celebration dance all the way home because I was like, no more 270, you know? But I really appreciate your guys' time, maybe in Stroke Awareness Month. And, really, there's no better time to talk about some of these things that we can look for and that we can spot than now. And right off the bat, with your guys' experience, strokes, I was just talking to you guys off the air, you've had people take naps and feel like, oh no, I'm going to feel better a little bit. What's the difference between, the stroke and then the heart attack? Because it seems like the heart attack's a little bit more, aggressive or more, is it just more, sharp pain? What's the difference between those two?
Well, first of all, both are serious diseases. Both are can be mortal and can lead to severe disability and death. The difference is the heart conditions most of the time is painful, so it alert the person to go to the emergency room. Whereas the stroke symptoms usually is not painful. Wow. It's painless. People lose function. They can't move the limb. They cannot speak. And most of the time they take it easy. They try to sleep it off. They try to take a nap and see if that symptoms will get better, which something that we don't want. We want the patient to call 911 right away, come to the emergency room because there is a time window that we can help the patient.
Absolutely. And with that being said, I wanted to ask you about Be Fast. It's just an acronym that I've seen in, waiting rooms and doctors' offices, but never really looked into it. What does this stand for and what does it mean?
So Be Fast is an acronym, and it's easy to remember. The B stands for balance. Look at the patient. See if the person is out of control and cannot walk straight. That's important. Look into their eyes. That's the E. B, E. So the eyes, where the eyes is jerking, deviating, or the person cannot see. So that's an important sign of stroke.
Wow.
F, the face. Just ask a person to smile, and the face is crooked, twisted. That indicate that there's some problem happening in the brain. The A stands for the arm. Ask the person to lift the arms up and see whether one arm is going to drop or drift. That indicates that there's a problem. And the speech, the S. Just talk to the person. See if they are slurred or they cannot talk. Sometimes they really lose the ability to talk.
Wow.
And if you have any of that,
it's
run
time
to the T, the telephone. Call 911. Be fast. Call 911.
And how quickly do these symptoms develop, if you don't mind me asking? Is it different for everybody?
It can be sudden.
Really?
You can literally be fine 1 minute and then the next minute just not be able to talk or not be able to walk, use your arm, anything like that.
Wow. And now, with that being said, just from my experience in my family, with strokes and everything else, I was going to ask you guys the difference between a TIA and a stroke. Do they have similar symptoms? And what's the main difference between the two?
A TIA is considered like a mini stroke. Typically, your symptoms happen, they progress and then kind of go away, and then you're back to your baseline. Whereas if you have just a full-blown stroke is one way you could call it, is where you have those deficits.
Yeah, so imagine somebody who has a chest pain.
Got you.
And that goes away. That's an alarm that there's a problem right there. A TIA is similar thing. So this is like a chest pain of the brain. And the person could have a small symptoms like lost vision for 10 minutes, or he couldn't move the arm for 10 minutes. That's a TIA. You have to go to the hospital. You have to check because that is a mini stroke and could be an alarm for a bigger thing.
Coming down the line.
Yeah.
That's actually very insightful because I've always wondered about that. Now, I wanted to ask you too, and listen, I'm probably not the best testimonial right here because I have a can of jet fuel in front of me that's probably not helping my heart out any. I've noticed that a lot of younger people, there's actually more and more cases of strokes happening. Is that what you've been seeing, sir?
Yes. Stroke in young population is a problem because they could harbor the same risk factors. Stroke comes from the main risk factors of high blood pressure, diabetes, smoking, and all these bad things. And if they don't address it at a younger age, stroke can happen. So there is a good percentage of stroke happen in young people. Of course, we don't like it because the disability is going to be lifelong disability. So it's important to address all these risk factors.
Absolutely. And with that being said, time is of the essence with these. And just how important is it to, right away, we're on the phone, we're getting into the ambulance and we're going. Why is time so crucial when it comes to these things?
The quicker you get to a hospital, the quicker you can get a medication called like a clot buster if you're a candidate for it.
Okay.
Which kind of goes in there and breaks up the clot, essentially. It's a very small window. So you have 4.5 hours from the time of onset of your symptoms before you aren't a candidate for getting it IV, but you can get it other ways.
Right. So the faster you get to the hospital, the faster we can help the person. With medication, as she said, we have the clot busting medicine, but also we can take it out surgically. So if there's a clot in the brain, we can take that clot surgically. So we can sneak our way through the arteries and then go up to the brain and fish that clot out from the brain. And that makes a difference.
Wow.
A huge difference.
That's very fascinating. Now, what's the recovery time on a surgery like that, if you don't mind me asking?
So it really depends on how soon the person gets to the hospital. So there is no damage to the brain. In fact, 2 days ago, I did one person. I did the clot retrieval on one person. She was discharged after 48 hours to home, fully functional, without a damage in the brain.
Now that's huge because if she would have waited the past 4.5 hours, then you're adding 8 months of recovery on if something happened.
Absolutely, you're right.
Wow, I didn't even realize that is advanced medicine right there. It's really is this been developed rather? Is this a newer thing?
It's over the past decades had developed, and now it's materialized. There is a lot of studies on these kind of treatment, and they all proven to be effective.
Wow. And now another thing that's really been picking up is telehealth and all of these great and innovative things that. I never say that the pandemic was obviously a good thing, but there's been a lot of advanced technology because of it, because we had to adapt on the fly. And OSF and SSM are collaborating on this telestroke program for stroke patients. Now, give me a little bit more insight on this. How does this work?
Do you want to start?
So if we have a patient that comes in for stroke symptoms, and we rule out that it's not like a bleed or anything like that, we have a robot, essentially, that the provider can decide that they want to utilize. We get in contact with SSM and the neurologist on call. They kind of pop onto the robot, assess the patient, and then...
Right. So the speed of having a specialized stroke doctor to look at the person and make a decision. That's the essence of it. So it's basically it's a video encounter. Mm-hmm. The person is going to be in their bed in the emergency room. We bring that video camera, put it in front of the patient, alert the doctor, like me, in my hospital. So I could go on my phone or on the computer, desktop, and I connect to the patient. I see the patient and see what kind of a stroke symptoms they have and what kind of a treatment that we can deliver in the emergency room, and whether we can move this person to a highly specialized center where we can remove this clot mechanically. So the speed, add the element of a speed on that.
Now, and I don't know if you guys have the answer. I don't want to put you on the spot, but how much time is that process cut down? Because to me, that has to be huge, because just traveling, wise and trying to get to a hospital to see a patient could be a longer process. How much time does this cut out?
So time is the essence of everything here. So from the time that the person hit the emergency room, we have the clock start ticking. We call that door to doing something, door to administer the medication. So we have to meet certain criteria. The faster, the better, of course. Mm-hmm. And when we encounter those patients, within 5-10 minutes, we make a decision. This person has to leave the emergency room in the helicopter or in the ambulance to the nearest center where we can remove this clot surgically.
That is just impressive to me. I mean, that is really innovative stuff, and this is a great program. Now, how long has this been in effect?
So we implemented this with OSF over the past 2 months.
Wow, so this is newer.
So this is new to Alton, Saint Anthony and Alton. So hopefully we will help more patients.
And and when this happens, it's just one of those things that nobody really needs to have any info on, just knowing if they do go in that situation or have a stroke, that this is the procedure that will be in place when they get to the emergency room.
Correct. I mean, there are certain criteria that the patient will have to fulfill.
Okay.
We do a lot of imaging, CAT scan, for example, to know where is the clot and whether this is accessible or not and what kind of a problem creating, etc. So we have to study that, but we have to study that very fast.
Yeah. And now, and how crucial is it for your guys' team to stay calm, cool, and collected too? Because I know that this is your guys' day-to-day, it's your profession, and but I'm sure there's still a little bit of nerve in there because that clock, when did it start? When did these symptoms actually start? Because, I'm sure a patient's told you, oh no, I just started feeling like this, but it could have been 2 hours ago that the drooping or those symptoms developed. How important is it for you guys to maintain your composure and stay on task here?
It's pretty important. I mean, if you're worked up, then your patient's going to get even more worked up, or a family member. So just kind of staying calm, knowing everyone's roles, kind of helps get the process going and maintaining it. The agreement that we have with SSM and us collaborating together has been really beneficial for our patients. Just because if we do use the teledoc program, get them on, and they suggest transfer because they have what is called like a LVO, or a large vessel occlusion, it kind of gets the ball rolling for the whole transfer process. So we don't have to go through trying to find a hospital to send them to. We kind of already have the neurologist on board. So it speeds up that time of getting them to where they need to go and getting the treatment done quicker as well.
Wow. I mean, that is really crucial, and that is very, very great information to know, and especially because this is stuff that you don't need to know until you need to know it. And that's why I think it's really incredible that we get the opportunity to speak with you guys over at OSF and SSM to be able to relay that message and know there will be these practices in place if this happens to you and you wind up in the emergency room or wherever you're at. Now, with that, I saw that you guys are actually using a new stroke drug in the emergency department. Can you take us through that a little bit more?
The clot-busting medicine. Mm-hmm. So clot-busting medicine, or called alteplase or tenecteplase.
Okay.
There are a couple of medications.
I was going to try to say the name, but listen, I couldn't do it.
So these medications been in the market over the past 2 decades, and we use them frequently for those patients whom they come into the emergency room very fast, within 4.5 hours. That's the medicine where we can give it. So it's the idea of it to dissolve the clot while it's developing in the brain and help the artery to open up on its own without doing extra. Now, has this been effective? Definitely. It works. It works. So we have to use it whenever the person arrives within short time. So that's why if anybody has stroke symptoms, come in to the emergency room. Don't wait. We have something for you to help you.
Absolutely. And it's one of those things, too, something that always comes to my mind, and I don't have this happening in my personal life or anything, but just the older adult that's by themselves. I mean, that's a pretty tough decision because you're looking at yourself in the mirror. You aren't having someone observe you, and that could be dangerous. Is there something that maybe you can, any insight on how maybe somebody that's living alone that's looking at themselves in the mirror might not be able to tell if they're having these things? Is there a way to, as somebody evaluating themselves can find out quicker?
Well, sometimes it's hard, to be honest. If an old person lives alone and started having stroke symptoms, they could lose the ability to speak. They could lose the ability to use their arm to call somebody to help. But if there is any signs of it, then please do something right away and alert somebody to come to the emergency room. But more importantly is a prevention, right? Yeah. So if somebody has a high blood pressure, go to the doctor, address it. Diabetes, same thing. Smoking, so bad. It can really lead to blockages in the major arteries.
That's what I was going to ask you about next, too.
Right. Yes, these are risk factors, causes, if you will, of a stroke. If you address them ahead of time, your risk is going to be much, much less. Now, one more point to address for the public, which is is call 911. don't really come by transportation, public transportation, because it's much faster to come in by an ambulance where we can triage the patient, give the treatment, versus if the person call a friend. And the friend will take time to bring the patient to the hospital. This will take really long time.
Well, I would have been there sooner, but the dog was barking, and we don't need any of that.
No.
And two, why not be able to be in the ambulance where if something, you start falling out pretty quick, you have a team there that's ready to assist and get you through the final haul to the hospital. And now with that, I wanted to ask you guys if it's okay. It's still early on in the studies and everything we're seeing, but with vaping, how is this, with smoking? Because I always heard, because in St. Louis, there's this thing going around now where you can't smoke inside, but you can vape inside, even
It's
though
all
they're
bad.
same thing. Thank you. Okay, so with that being said, is it still this? Is it even more of an increase, or is it around the same as just regular cigarettes?
It's the same. It's all bad.
Right.
It's all bad. There is a public conception about vaping. It's better than cigarettes, but the nicotine is still there.
Right.
So the damage in the vessel is still happening, maybe on a slower mode. Now, we started seeing a trend among young people to start vaping and even thinking about vaping early because they think it's safe. No, that is not safe.
Mm-hmm. Absolutely. And with that being said, Heather, if you don't mind me asking, how long have you been with OSF in your tenure?
So in July, I'll have been here for 5 years.
Wow.
All emergency background until I took the stroke coordinator spot.
Wow. And my grandma was an ICU nurse, so I know, just how hard you guys have to work in the ER and ICUs and surgery room, all those things. It takes a special type of person to be able to do what you guys do to save lives and really keep us all healthy. Now, with that being said, how has this merged with SSM, in your opinion? You've been there for 5 years. How has it made the efficiency, increase, better over at OSF?
So we kind of had a program prior to switching to this that was located out of our main hospital in Peoria. Since the transition to this, I think it's just been more beneficial in regards to like the process of getting the transfer started, like I said. They were quick to respond as well with like the teledoc process, but then you still had to work on the aspect of getting the patient transferred to a local hospital, getting them accepted and all of that. So this has kind of helped bridge that gap just because, even though our main hospital's in Peoria, we're 3 hours away. So those resources really aren't that great for us when we can just go right across the river and in 45 minutes have a patient there to start getting the treatment process started. So it's been very beneficial for our patients, I think.
Without a doubt. And now with that being said, I'm sure I haven't even checked the text line because we had like way too many before I even started this interview. So I was going to get overwhelmed. But I think another question that folks would have is when you're at home, what's the best way to make sure that you're keeping yourself healthy to prevent these strokes? Is it just routine checkups, making sure you're being diligent with your primary care provider? Is there anything more?
You said it. The routine, seeing the doctors, follow up on medication. Don't skip anything. Stop smoking. Smoking is a big issue. Exercise, of course. If you keep yourself healthy, then your brain's going to stay healthy. So these are the things. Keep it up.
Absolutely. And now, is there any more information about strokes that we need to be aware of? Is there, maybe a hidden symptom? Is there, anything that we haven't touched on yet that needs to be disseminated in this?
One of the things that you see, the most common kind of a stroke is blockages in the arteries.
Okay.
But we encounter also bleeding in the brain. Bleeding in the brain is about 10%. So out of 10 persons arrive to the emergency room, one of them, they could have a bleed in the brain. Wow. And the bleed in the brain usually exhibit different sets of symptoms. The majority of those is massive headache or loss of consciousness. Sometimes people could have loss of consciousness, but they don't come to the hospital. They could really mix it up with their migraines. So if somebody has really bad headache, come to the emergency room. That could be a sign of a bleed in the brain.
Wow. And that's great to know. And actually, I know somebody that had that situation very recently where it was a brain bleed and very dangerous very quickly. Yeah. With that being said, I can't thank you guys enough. This has been a great interview, and I really appreciate your guys' time at OSF and SSM and the team and the newsroom and media team to put this together. And I just want to point out one thing before I say goodbye. You drove 45 minutes over here to be with us today.
Yes.
And to me, that is the coolest thing because you guys work hard. And I mean,
Absolutely.
you don't have a day off. But to sit here and say that you gave up your time, an hour of your drive time, and then 25 minutes of your, time here is really cool. So thank you so much.
Absolutely.
That's our phone line. We have our phone line routed to this computer, and my phone now because I keep missing them. And people are wanting to talk to you guys, but we got to go. It's 10:50. Thank you so much for your time and your insights today.
Perfectly.
Thank you.
Take a quick break. We're going to talk St. Louis Cardinals when we come back. And yeah, I know. I don't know what they're up to either. It's give and take, and we'll see what they're doing and limping to the barn with next.